So for those of you who have tuned in before, you'll know that our salon is very eclectic and we always invite a guest speaker. And tonight it is our great honor to introduce to you Dr. Sarah Giardenelli, who was raised in upstate New York, and she completed her undergraduate studies in pre-medicine and psychology at the State University of New York at Buffalo. She knew from an early age what she wanted to do. She wanted to help people achieve optimal health, and she found her calling at the National College of Natural Medicine in Oregon. After 6 years of study, Sarah earned both a doctorate in naturopathic medicine and a master's of science in Oriental Medicine. With over 10 years of clinical experience, she has a keen interest in many areas of practice. So I'm going to list them: integrative medicine, clinical nutrition, environmental medicine, chronic disease management, Chinese and Western. Have I froze?
You're good.
Okay, I'm looking to see if anybody's moving. Okay, Chinese and Western herbal medicine, and women's and geriatric health. She likes to uncover the root causes for patients' ongoing health challenges and provide a personalized approach to optimizing health based on lifestyle and natural medicine. Dr. Sarah's passion for improving the health of her community led her to found her own practice, which is called the Digestive Health Center. It's located in Leesburg, Virginia, my old stomping grounds. And she's also president of the Virginia Association of Naturopathic Physicians. And I believe she's been instrumental in helping lobby our Virginia legislature to finally legalize marijuana. So we'll add that to the list of. I
haven't been involved in those efforts, but I've been trying to get the naturopathic profession licensed in Virginia.
Okay, I might have heard that from Pete. All right, scratch that.
I think Pete has been integral in that.
Okay. Well, Dr. Sarah, welcome, and I'm looking so forward to your presentation, and I know everyone else is too.
Awesome. Thank you so much for having me. I really appreciate being here, and the association I'm presenting on behalf of the Virginia Association of Naturopathic Physicians, and we are glad for this opportunity to share more about our profession in Virginia. I'm going to share the presentation that we have put together, and I'm going to start off just sharing a little bit about naturopathic medicine and our legislative efforts, and then I'll kind of transition into just generally about how a naturopathic doctor might approach health, just to give you a little bit of a better understanding and flavor of what it is that naturopathic doctors can bring to Virginians. All right. I'm trying to advance this. So founded in 2005, the Virginia Association of Naturopathic Physicians, the VAMP, is the professional trade association representing naturopathic doctors in Virginia. And we are here to expand awareness and access to naturopathic doctors and help our members build successful practices. And in terms of the definition of naturopathic medicine, we diagnose and treat and help prevent diseases using a system of practice based on the natural healing capacity of individuals. And that's one very unique thing I would say about naturopathic medicine, is that we believe that the human body has a vital force, and that as the practitioner, it's the naturopathic doctor's job to help to support that healing using as natural methods as possible. And so we are trained in all sorts of methodology, be it natural medicines, but we're also medically trained naturopathic doctors are also trained up in prescription or legend drugs, as well as food, herbs, and other natural remedies. So it is a real integrative profession. So we blend the conventional scientific and empirical methodology with natural therapies. And we concentrate on really whole patient wellness and wellness care, a wellness model of a healthcare instead of a disease-based model. So in terms of our medical education and training, medically trained naturopathic doctors successfully complete a 4-year in residence doctoral program in naturopathic medicine. So there are 4 different types of medical schools in the United States. We have our conventional MD medical schools, we have osteopathic medical schools, we have chiropractic medical schools, and we have naturopathic medical schools. In terms of accreditation, the naturopathic programs are overseen by the Council on Naturopathic Medical Education, and each of these medical schools has their own accrediting agency that is recognized by the United States Department of Education, including naturopathic medical schools. Naturopathic medical doctors complete a 4,000-hour doctorate program that includes over 1,200 hours of hands-on supervised direct clinical patient care. We pass standardized licensing exams. You'll see over here. And we are medically trained and educated. And this is a nice comparison chart that I helped work on for one of our bodies, organizations that is provides public information about naturopathic medicine, just comparing the ND curriculum to that of medical doctors and nurse practitioners. And in terms of core competencies of primary care, basically, they're standard across naturopathic doctors who are medically trained medical doctors, osteopathic doctors, and nurse practitioners. The main differences lie, I would say, in terms of the residency, whereas medical doctors and osteopathic doctors have more residency, but they're also training in more urgent and acute methodologies. So I think it's appropriate that they have more. And also naturopathic doctors have a significant amount of additional training in lifestyle counseling, botanical medicine, physical medicine, and hydrotherapy and nutrition. You can really see those hours in clinical nutrition are hugely different, where naturopathic doctor training programs vary between 100 and 200 hours of training in clinical nutrition, whereas there could be 0 to 70 hours for medical doctors or osteopathic doctors, and this about 10 to 19 hours for nurse practitioners. So there's a huge focus on an emphasis on lifestyle medicine for naturopathic doctors. And we are lifestyle doctors at heart, I would say, and who are able to think holistically and also think about a therapeutic order. And so, you know, if somebody comes into us and they really need a referral to a specialist, or they need a pharmaceutical, we are trained to recognize that. But by and large, for most of our chronic diseases, as most of you are probably well aware, these are lifestyle driven, and they can be approached with that minimally invasive natural medicine and nutrition, exercise first as a prescription. I think I've addressed this pretty good. In terms of work environments, you can see that that's similar across the board, except naturopathic doctors don't tend to work in the pharmaceutical industry. And we are not hospital-based doctors, so we don't tend to work in hospitals, although some of us do. I have worked in a hospital-based setting. I've worked also in a integrative primary care setting that was acquired by a large hospital system. So some of us have and do. And so as an association, we are on a mission to enhance human health and wellness in Virginia by advancing the profession of naturopathic medicine. And naturopathic doctors guide their patients through effective prevention and management of disease and empower their patients to experience optimal health and wellness through the application of conventional medical and natural approaches, ranging from nutrition and lifestyle changes to targeted use of botanical and pharmaceutical medicine. And so naturopathic medicine can really be part of the solution to the healthcare challenges that we have in the United States and in Virginia, helping to address the provider shortfall by providing solutions to acute and chronic pain management. We really need a biopsychosocial approach to pain management. I think I heard Floyd County mention, and Floyd, as some of you who are there know, was one of the most hardest hit counties by the opioid crisis. And part of that is due to the lack of access, and also the fact that, unfortunately, pharmaceutical management is often cheaper than a holistic approach that includes psychological care and physical medicine care. And botanical care is not even integrated into the United States healthcare system, even though it should be. And yes, cannabis is a great option for pain, but it's not the only herbal that we have. And naturopathic doctors are trained to incorporate botanical medicine in their practices. And there's all different types of herbs for all different types of pain. So yeah, we can use a more targeted approach with lifestyle, helping to, the heart of chronic pain is inflammation, and lifestyle factors are such a big cause of inflammation. So we really need to be focusing in on that. And, I think I'm probably preaching to the choir with that. So, all right. So why licensure? And a lot of people will ask us, like, why do you want to get regulated? There's I would say in Virginia, even though I guess we are now a blue state, there is still we're still more of a resistant state to move forward in some ways. I would say maybe you all have a different opinion on that, but after having been through 2 years of intensive legislative process, I'm like, wow, it's a pretty and I also did my training for 6 years on the West Coast in Portland, Oregon. So for me, there's a lot of resistance here and a lot of old entrenched systems that are difficult to push the needle on. So why do we want licensure? Why do we want regulation? Without regulation in Virginia, we are practicing with one hand tied behind our backs, where we can offer a lot of the lifestyle medicine, which is foundational, and that is the heart of naturopathic medicine. We are not able to incorporate the medical aspects of our training. So we're not able to diagnose, treat. Insurance companies will not credential us. We're not able to use level of service coding. Therefore, if a patient sees me, they can't even submit a claim to their insurance to be able to get reimbursement. So it really limits access to the type of care we provide to a number of patients. We're not integrated in the system without licensing. And so we really need more holistic providers in the system, except we can't get the foot in the door without licensing. Also, like in terms of why licensure, why do most states consider licensure? It's to protect public safety, because right now anyone with any kind of training can call themselves a naturopathic doctor, and they may not have any training at all. They might have 50 hours of training, and some of them even wear white coats, stethoscopes. And so patients seeing them assume that they have some type of medical training, and maybe they have none at all. So it is very important to protect public safety, ensuring patient choice. Right now, patients lack the choice to see medically trained naturopathic doctors because there's not a lot of us here, and those of us that are here are quite limited. And it promotes accountability and transparency. And so there's different types of naturopathic doctors out there, and some are traditional. And patients ought to be able to continue to be able to see whatever type of provider they want to see, but they ought to also be able to understand the differentiation and training that there is available. So right now, across the United States, there are 22 states and territories that regulate naturopathic doctors, and 14 states even allow naturopathic doctors to prescribe necessary medications. And again, why is the pharmaceuticals part of what a naturopathic doctor wants to be able to do? And it's because a lot of patients are on polypharmacy. And I'll get calls from seniors who are on a number of medications, and their doctors don't have time to help manage these things. So they're prescribed another medication and another medication instead of somebody taking a step back and looking at their whole picture. And if in states where naturopathic doctors are allowed to prescribe pharmaceuticals, we're able to help manage those pharmaceuticals and get patients off pharmaceuticals. Whereas when we're not the prescribers, we're not even technically allowed or legally allowed to, tell the patient what to do with those medications. So then it's a matter of co-managing, and a lot of the doctors right now with the conventional model don't have time for that. And naturopathic doctors do have time for that and want to be able to help patients better optimize their pharmaceutical management. And then also 12 states have some degree of insurance coverage for naturopathic doctor services available. And in Virginia, I would say when I get a phone call, that's among the first question a patient asks: are you covered by insurance? Can I submit to my insurance? And unfortunately, because of the lack of licensing, no insurance company will credential a naturopathic doctor. I have to tell them no. All right. And so Laura had asked me to share a little bit about our legislative history, and I will was because there was a decline in naturopathic doctors. And so they didn't feel that there was a need to license naturopathic doctors anymore at that point. Since then, there has been a resurgence, and naturopathic medicine is a re-emerging healthcare profession in the United States. And there's a long back history of that with the Rockefellers and the Flexner report that I probably won't get into so much in this presentation, but is all very interesting in terms of the history of medicine and the medical dominance paradigm in the United States. A little controversial too, which is sometimes fun to discuss. That would be a fun conversation one day to have with you all. But Virginia Association of Naturopathic Doctors has put forward 8 licensing bills for naturopathic doctors since 2006. And the Virginia Department of Health Professions has conducted 2 studies on the need to regulate naturopaths in 2005 and naturopathic doctors just recently in 2020. And in the 2021 regular legislative session, our bill, HB 1040, made it to the floor of the Health, Welfare, and Institutions Committee, and our bill champion was Delegate Rasul from Roanoke area, who's actually running for Lieutenant Governor, and he's an excellent champion for increasing access to healthcare and also protecting the environment. He is a pretty neat guy. Recently, our profession underwent here, there was a research and regulatory committee, a subcommittee of the full board of health professions. And they determined for the first time that naturopathic doctors do meet the 7 criteria that they have established to determine if a profession should be licensed. And if anyone could guess what the first criteria for licensing is in Virginia, I'd love somebody to guess. Anyone can guess? I'll tell you, it's risk of harm. So criteria number 1 is the Gatekeeper Criteria. And that is why in 2005, they determined that we didn't need licensing. But in 2020, they decided, okay, I guess you're dangerous enough now. And so they determined that we met that criteria number 1. And so they went on to study all these other criteria, 2, 3, 4, 5, 6, and 7 that you can see here on the screen. And they determined that, yes, we have specialized skills and training, and we have a distinct scope of practice, and there is some economic impact to patients who are not able to access our services because of lack of licensure, and there's no appropriate alternatives to regulation, and licensing is the least restrictive regulation. So they decided that. They did a lot of hard work, this subcommittee, and then 20 minutes later, after they made their decision, it went to the full Board of Health Professions, which is staffed by heads of each different, like the Board of Medicine, the Board of Nursing, the Board of Psychiatry. So each head of each of these different Virginia agencies is part of this Board of Health Professions, and also including several members of one of our opposition groups have public members on that board. So in my opinion, due to systemic bias, we did not pass through that full board, even though their own committee decided that we did meet the criteria. And so out of 20 health professions evaluated for, but that is Virginia politics, by the way. It's just like this. That's for anyone who's in politics in Virginia. There is a lot of entrenched systemic bias and where lobbying groups have, in my opinion, way too much influence on regulatory process. So out of 20 health professions evaluated for regulation by the Department of Health Professions over the past 20 years, the Research and Regulatory Committee has voted in favor of regulation 9 times, unanimously 8 times, and the full Board of Health Professions has adopted the recommendations in every single instance except for naturopathic doctors. So we are the most well-studied profession in Virginia, having undergone 2 studies by this Board of Health Professions and also another study in 2012, 2013 by the Joint Commission on Healthcare. And the most favorable study was the last one in 2020 that was done. And naturopathic doctors are also the only ONET Zone 5 medical occupations that is basically a Department of Labor designation that does not have a practice license in Virginia. And which is a shame because we're in a global healthcare crisis, provider shortage, and we have the pandemic. And all of these things are limiting access, patient access to qualified providers. So, everyone who can help serve patients ought to have a license in Virginia, including naturopathic doctors, to be able to serve patients to the full scope of their training. But unfortunately, that's not how it's rolling yet in Virginia, but hopefully we can push the needle. And part of the reason I am, doing this presentation and educating and why we need to continue to do that and share more about what we offer is to help move the needle. So the holistic and preventative biopsychosocial approach is essential to address the epidemic of chronic disease, driven often by lifestyle factors, and the pandemic has really highlighted that need. And so the citizen and activist engagement, so, I think we can all agree that patients do deserve access to healthcare of their choice. And I think hopefully now that I've explained why regulation is important, we could all agree that that can help increase safe access to patients. And hopefully some of you will be so inspired to help support this effort. So thanks for having me share about that. I would like to share a little bit more, just pivot a little bit to share just a little bit more insight about the naturopathic approach that's not so wonky into regulation, policy, and licensing, because certainly that's not where my passion is at. My passion is helping people attain their optimal wellness and be on that journey with them, which is a really special journey to be on with patients. But naturopathic doctors are really interested in treating the whole person, and how can you do that if you're just focused on one part? And this is kind of a joke, but it's really sad. Right now in America, I think antidepressants are one of the most prescribed pharmaceutical medications, and we are having more isolation, social isolation, and we need to really change the paradigm of approach and that we have. And in terms of a naturopathic model of healthcare, we consider all of these different aspects. And yes, I think most professions consider doing, first do no harm, and treating the whole person, a healing power of nature. And that is this inherent belief in naturopathic medicine that the human body does have some healing capacity that we can support. And prevention and doctor as teacher is a really important part of our philosophy as a profession. And so naturopathic model of healthcare is where we consider the individual as a unique person affected by their varied life experiences. And pathology is really the last expression of a disease process. And prevention is really treating the individual before symptoms occur. So really keeping people well. Unfortunately, I'll be honest, a lot of patients, especially in Virginia, will only get to a naturopathic doctor after they've exhausted all other options. So unfortunately, I'm seeing patients when they have multiple comorbidities, and I get referred a lot of challenging patients, and I love working with those patients and trying to figure out what we can do to help reverse that process. But it's also really fun to see some healthy patients, which I do have some of those too, who want to stay healthy and using lifestyle methods, botanical medicine, mindfulness, exercise, all the making sure they're getting proper sleep, all the core foundations of good health. So yeah, I think most of us can understand that health is really about balance, and it's about balancing the stressors on the body and to our responses to that. And so I often share with my patients, our health is like, we can think about a bucket of stress. And if we can take some of the stress out of that bucket, sometimes even if there's still a lot of junk in there, things can kind of shift back into where the body can function better. And we, as naturopathic doctors, consider all of these different areas as very important to health. And so, I have a very detailed intake form where I ask people about all these things. And sometimes they'll share with me like, wow, you're the first doctor to ever ask me about all of these different aspects. But they are important. And if we're not thinking about them and encouraging patients to get proper support in these areas, they may not get well. Some of these things can be major obstacles to healing for folks. And so we're thinking about the energy and the spirit and the biochemistry and the physical body. And even, from a botanical medicine perspective, we're thinking sometimes, not just about, what this herb can do for somebody like on a physical level, but, what is the nature of that herb and how can it uplift somebody? And are we, is it the right season to use this botanical? And, does a patient have the right constitution? And a lot of these kind of ideas about matching patient characteristics to botanicals stem from our Eastern medicine philosophies of Ayurveda and traditional Chinese medicine, and they've kind of been adopted within the naturopathic paradigm. And so where do you start? And so, often naturopathic doctors start with detox. How can you get somebody's body detoxing and moving better? And so we think about how we can support all these really important areas of detoxification, in particular the gut. Often, if you see a naturopathic doctor, they're going to ask you about your food sensitivities and how your bowel movements are and how we, are you constipated? If you're constipated, we definitely need to address that first. So it's not unusual for, I remember, I will share when I first started going to naturopathic medical school, I would kind of practice my intakes on my family. My sisters would just laugh about all of the stool questions that I would have. So, are they sinkers? Are they floaters? But that digestive tract is such a reflection of the rest of somebody's health that it is actually really important. In terms of the lymphatic system, this is a system that is often overlooked in medicine. And we even just, I think in 2013, discovered that we have a lymphatic system in our brain. And this is how those amyloid plaques kind of get cleared out, is when we sleep at night, they get cleared out by the lymphatic system. I think it's called the lymphatic system in the brain, but that only happens when you are sleeping and getting proper sleep. And so the lack of sleep will definitely increase risk of dementia and Alzheimer's. And I will say too, also hearing loss is a big contributing factor, which is a total sidebar. But I'm a big fan of hearing aids. And I think a lot of people don't know that lack of hearing is a significant factor in cognitive decline. So that's just my public service announcement. Nothing to do with this talk in too much ways, but I think it's just a fact that a lot of people don't know about. And hearing aids actually can help reverse and slow that cognitive decline. So I know a lot of people are resistant to hearing aids. My pop is in the other room. I wish he would heed that advice, but he gets pretty annoyed when I mention it. So I'll share it with people who maybe want to have that information. So, and then deep breathing is another way. So in terms of moving the lymphatic system, how do we do that? So it doesn't have vessels like the vascular system. So the only way it moves is when we move through deep breathing, dry skin brushing. I'm not sure if anyone's familiar with dry skin brushing, but it's basically you can use a loofah, you can use your hand and just gently brush up where the heart, because that is where the pump is to the lymphatic system that goes down to the liver for detox. And so you can just take 30 to 60 seconds and brush the body with your hand, going down, up each arm and up each leg. And you can do that before you get into the shower. Deep breathing also helps to move the lymphatic system, as well as helping to reset the central nervous system tone, relaxing blood vessels, lowering blood pressure. There's a cool FDA-approved device called Respirate that is clinically studied and approved as a blood pressure device. And so I love that device. It's a neurobiofeedback device. Basically, it lowers your respiratory rate. And if you use it for 15 minutes a day, it's clinically studied to actually lower your blood pressure. So the breathing, of course, you could do deep breathing without a machine, but suffice it to say, it's very important for optimizing overall health. And a nice breathing technique is triangle breathing, or not triangle breathing, rectangle breathing, or square breathing, where you inhale for 4 to 6 seconds, you hold your breath for 4 to 6 seconds, and then you exhale over 8 seconds. And so that's a pretty simple technique, if used for a few minutes a day, can really be effective and powerful. We can use it when we're stressed, and it will help. Just 3 minutes of doing that deep breathing, that deep diaphragmatic breathing, will help to lower the cortisol levels. And so especially when we're all kind of in a global state of stress, the breathing can have a lot of wonderful benefits. In terms of hydration, it says half your body weight in ounces of water. That's a loose rule of thumb. Traditional traditional health practices like TCM don't subscribe to that. There's a set amount of water that needs to be consumed, but it is important to stay hydrated so that our cells can properly function and detoxify. So, and a lot of us do forget to drink water during the day. I can, sometimes go the day stuck on my computer too. Movement is obviously important. And then hydrotherapy is another method that helps with detoxification in the body and also helps enhance the immune system, and it's also free. So it's a great way to help optimize immune function that we can do at home. And so I'll have people sometimes do contrast hydrotherapy, where you can put on your throat, for example, if there's a sore throat, 30 seconds of hot, so 3 minutes of hot, 30 seconds of cold, and you just alternate it 3 times. You can do it on the sinuses. That's great to do right now during allergy season because it helps to vasodilate, which helps to bring blood in. And then when you put that's with the warm, and when you put the cold on, it vasoconstricts. So then clears all the junk out of the sinus areas. And it can be really, really helpful and underutilized method during allergy season, along with a lot of people are familiar with like saline sprays to the sinuses or nasal lavage, but the contrast hydrotherapy can be great. And Castor Oil Packs. I bring this up because we have Edgar Casey in Virginia, who is a medical intuitive, who kind of brought the Castor Oil Packs into, I guess, fruition. So not a lot of evidence base around this. That's in terms of like, scientific, research journals proving that it can be an effective approach for detox. Over the whole abdomen, and then putting a heat pack over the abdomen for 20 to 40 minutes. And you can do this daily, and it can be really helpful to help with liver detoxification and hormone balance. So this is another kind of old school approach that has been adopted into the naturopathic detoxification approaches. I talked about dry skin brushing already. I talked about the importance of sleep already. And, vitamin D right now, we're hearing more about vitamin D than we have in the past because of how important and how the deficiency has been seen to be a significant risk factor for COVID-19. And right now, the sun's coming back. And so that's a great way to help convert vitamin D on the skin level and increase vitamin D levels. And I talked about the importance of digestive health a little bit already, and how naturopathic doctors tend to focus on that through looking at diet, how much fiber somebody's consuming, how their bowels are moving. But I will say probably the most effective, important way we can optimize our digestion is through mastication or chewing the food properly, making sure it's liquid before it goes down in the belly. Just even thinking about the food and taking time to really nourish and prepare the food helps to increase the hydrochloric acid in the stomach, which is really important to help defend our body against microbes that might create a negative environment in the gut, and also to help break down our proteins. So that chewing is really, really essential. And we also have amylase in our saliva that helps to break down the starches. And so I think a lot of the indigestion and reflux issues we see in our society is due to, eating on the go, eating on the run, eating in the car, and not taking time to really smell and chill with our food. We can't digest our food properly if we're stressed. So, and apple cider vinegar is another method which can really help to increase hydrochloric acid. It also has a whole bunch of different minerals and pectin as fiber. And so this is a nice way, easy way to stimulate digestion. It's just a few teaspoons or 1 tablespoon. Definitely add it to water because you don't want to ruin the enamel on your teeth. And you can consume that about 15 minutes before your meals to help stimulate digestion. And then eating organic, eating a whole array of different foods. Diversity in the diet is really important. Eating anti-inflammatory generally. So I'm not going to get too much into the weeds with diet, but suffice it to say it's something that we do work on with our patients. There's not any one particular diet that I found is necessary for any one particular patient, but I will say, by and large, most of us don't eat enough vegetables. We don't eat enough, have enough diverse diet. Legumes and nuts and seeds are often missing from people's diets too. So that's tend to be where, if I have one thing I tell patients over and over again, is eat your vegetables. And sometimes people don't know how to prepare them, or whatnot. So we'll talk. I'll spend time with my patients on that too. And sometimes healthy oils are missing from the diet. So yes, and certain foods can be inflammatory to some people, and it's different foods for everybody. So we hear a lot about generally say that naturopathic doctors consider the environment, patient's physical environment, as well as what's actually in that environment that might be contributing to their health as important. And I think that's another unique facet where naturopathic doctors are considering environmental home toxins as influencing patients' health. And we probably, each and every one of us might know somebody whose health has declined from things like mold toxicity or mycotoxin illness. And so that is an area, as an example, where naturopathic doctors thrive. I have patients in the Northern Virginia region who have served in like Superfund sites and who have had like dry cleaning chemicals and heavy metals on board. And so like this is an area most other doctors are not even thinking about asking about, where naturopathic doctors do ask about. And so we're talking to people about their home chemicals and how you can basically make your own home cleaning solutions with vinegar and water and maybe some essential oils. And so we're thinking about each and every area of somebody's, a person's health. We recognize that dust is the most toxic thing in your home and a person's home, because a lot of the different chemicals bind into that dust and then we inhale it. And so we're thinking about how important the indoor air quality is for cardiovascular health. Like I don't think a lot of doctors, other types of doctors, make those type of connections for patients. And we're not shy to refer. You see that's at the center when we recognize when things are outside our scope. But all of these different aspects we do consider. And so again, thank you for your attention and interest in naturopathic medicine in Virginia, and for any support that you might lend in advocating to legislators. And I'll take some time for questions.